The prevalence of childhood obesity has more than doubled in the last 20 years. Obesity in youth can lead to increased risk for cardiovascular disease, bone and joint disorders, and psychological problems. Pharmaceutical care is a patient-centered practice where the pharmacist works with the patient and other healthcare providers to promote health, prevent disease, and ensure safe and effective drug therapy. There are 3 steps in the pharmaceutical care process. They are identify, resolve, and prevent any potential health and drug-related problems.
A quick and accurate way to identify children that can be categorized as overweight or obese is the equation for body mass index, or BMI. Body mass index is a measurement of weight for height that is used to classify overweight and obese adults and children. The BMI equation is weight in kilograms divided by height in meters squared. The following chart identifies underweight, normal, overweight, and obese BMI ranges. We also need to identify different unhealthy behaviors that children and adolescents today often engage in. Examples include lack of physical activity and consuming foods high in fat and sugar. Since patients visit their pharmacist on a more frequent basis than their doctor or dentist, this gives us an opportunity to routinely identify problems with weight, physical activity, and eating habits.
Pharmacists can resolve potential drug and health-related problems. The most obvious way is through managing medications to control disease states. What many people do not know is that your pharmacist has extensive knowledge of diet, nutrition, and exercise. Pharmacists can help patients set realistic and attainable goals, such as eating a healthy diet or promoting exercise to lose weight. Because pharmacists typically see their patients more frequently than their doctor, they can more easily monitor patients' progress towards goals during pharmacy visits. One of the ways a pharmacist can work with other healthcare providers is through medication therapy management, or MTM. MTM is a partnership between a pharmacist, a patient, and another healthcare professional. MTM promotes safe and effective use of medications and helps patients achieve goals of medication therapy. Pharmacists can also work with other healthcare providers to find ways to motivate children to be more active, whether it be through finding fitness activities children can enjoy or educating patients about nutritional choices. Pharmacists can also work with officials in the public forum to promote healthcare programs such as smoking bans, removal of soda machines from schools, and setting nutritional standards for school lunches.
There are numerous ways you can have an impact on the prevention of childhood obesity, both within your local community and when counseling your individual patients. For those healthcare providers that are involved with their local communities and governments, the CDC has created the Measures Project, which details 24 strategies that we can use to promote good nutrition and physical activity, such as increasing the availability of affordable, healthy food and beverage choices. We strongly suggest you to become involved with the healthy lifestyle decisions of your community and insist on implementing some of the CDC's recommended strategies, which can be found on their website. Now, let us detail some significant prevention points that can be used for discussion with your patients. Encourage patients to become aware of portion sizes. Many people do not notice differences in portion sizes and unknowingly eat larger amounts when presented with larger portions, especially if they are anything like me and suffer from what I like to call clean your plate syndrome. This unhealthy eating habit could be a result of sayings such as, "Don't waste any food because there are starving kids in Africa." Please stop this, because it's leading to larger kids in America. Another important counseling point is to encourage breastfeeding, which, among its many benefits, is the potential to decrease the risk of overweight children. Finally, be able to educate your patients on how to read a nutrition facts label. As you can see from this nutrition facts label, you should start by checking the number of calories. Then try to limit the amount of bad nutrients, which are trans fat, cholesterol, and especially sodium. It's also good if you can get some of the better nutrients, which are vitamins A and C and calcium.
With the help of the entire healthcare team, childhood obesity can be prevented and reversed. For more information and tips on nutrition and physical activity and what you can do to help in your community, please visit www.cdc.gov/healthyyouth/obesity.